It's 3 a.m. You are the only registered nurse in a 100-bed facility. Suddenly, a resident has a fall, another is exhibiting acute respiratory distress, and the phone is ringing. You are the clinical lead, the emergency responder, and the decision maker, all at once. This isn't just a tough shift, it's the reality making headlines across Australia right now. But is this model sustainable, or is it a disaster waiting to happen for your nursing license? Welcome to the Aged Care Insider with Nurse Dottie. Today, we are pulling back the curtain on the only RN on shift model that is currently under fire in the media and by regulatory bodies. As international nurses and new grads enthusiastically enter the Australian workforce, many are finding themselves thrown into the deep end without enough support. By the end of this video, you'll understand the legal risks of this model, the clinical dangers it creates, and, most importantly, how you can protect yourself and your residents when you are the only clinical lead on site. In recent months, mainstream Australian news has been flooded with stories about the aged care staffing crisis. While the public hears about ratios, RNs on the floor know the truth is more complex. The only RN model means you are responsible for everything from S8 medication administration to wound care and emergency leadership for a team of PCAs and ENs who look to you for every clinical decision. Meanwhile, research shows that when an RN is stretched across multiple wings, subtle signs of deterioration, like a slight change in respiratory rate or increased confusion, are often missed until it becomes a full-blown emergency. This is where the headlines come from. It's rarely one big mistake. It's a series of small, missed cues, not because you don't care, not because you are unskilled, but because, as the clinical lead, you are simply spread too thin. The thing is, the pressure isn't just about the workload. It's about the mental load. When you are the only one with the clinical assessment skills to identify a deteriorating resident, the margin for error is paper thin. We're seeing more coronial inquests focusing not just on the facility's failure, but on the individual RN's decision-making during these solo shifts. Let's look at the clinical reality. In a hospital, you have a met call button that summons instant help from every direction. But in aged care, you, the RN, are the met call. The Aged Care Quality and Safety Commission is watching. Standard 3 of the quality standards is clear. Clinical care must be best practice and tailored to the resident's needs. But how do you meet best practice when you're responding to 3 incidents at once? If an incident goes to APRA or a coronial inquest, I was the only RN on duty, is rarely considered a full defense. The focus is on whether you followed facility policy, whether you escalated appropriately, and critically, what you wrote in your progress notes. The regulatory model expects the same level of care regardless of the staffing model, placing the legal burden squarely on your shoulder. So, how do you survive and thrive in this environment? First, you must master the art of delegation. Your PCAs and ENs are your eyes and ears. You need to train them on exactly what red flags to report to you immediately. Second, prioritize your rounds. Don't just wait for the call bell. A proactive 5-minute visual check of your high-risk residents at the start of your shift can save you hours of emergency response later. Finally, know your facility's emergency and escalation policies inside and out. Knowing who to call, whether it's the GP, the on-call manager, or 000, should be muscle memory. In the eyes of the law, if it's not documented, it didn't happen. When you are the only RN, your documentation is your only defense. You need to move beyond resident rested well to clinical, defensible notes that show your assessment and actions during an emergency. Have you ever been the only RN on shift during a major emergency? How did you handle it? Let's share our experiences in the comments so we can learn from each other. If you found this insider helpful, please like this video and subscribe to the channel. It helps us reach more nurses who need this support. And also, please check our resources in the description to help you in your journey. Thank you for watching. Remember, we're in this together. Nurse Dottie.